coming out of DC's newest hospital.
We got to ask ourselves whether it's even safe to go there to get medical assistance.
A former patient bringing harmful allegations to light.
Concerns against DC's newly opened hospital, accusing it of repeatedly failing to care for patients.
And in one case, a patient died, and a surgeon later said they should have been operated on much sooner. DC News Now's Ben Dennis joining us live here in studio. And Ben, these are really serious allegations.
Yeah, not only that, take a look. Lengthy indeed. We've poured over all of these documents, Chris and Susan. They paint a troubling picture, pointing to breakdowns in patient care, including delays in emergency treatment, gaps in monitoring, and failures to follow basic protocols. As patients and city leaders demand answers, we took a closer look at what reportedly went wrong.
There's also a report of a wrong site surgery. An individual came in to have an appendix removed, and instead their ovary was removed.
Eye-opening accusations now being raised by D.C. council members, sparking serious questions about patient care inside Cedar Hill Regional Medical Center, a hospital that opened less than a year ago in Southeast D.C.
The challenges have led to a financial strain, unmet healthcare needs, and a hard-to-repair distrust.
One case outlined in documents from D.C.'s Department of Health shows a patient who needed emergency surgery within 2 hours, but records show delays getting her into the operating room. She later died during surgery, and a surgeon acknowledged she should have been taken in much earlier. Investigators also found confusion around calling in the surgical team, with key steps left blank. In another case, just days after the hospital opened, a patient arrived with dangerously high blood pressure, 261 over 171. Investigators say there was no immediate treatment recorded, and the patient was sent back to the waiting room. Their condition worsened, they became confused, suffered a seizure, and had to be intubated. Records also show no documented reassessment for 12 hours, and a critical medication was delayed.
We got to ask ourselves whether it's even safe to go there to get medical assistance.
Advisory Neighborhood Commissioner Tom Donohue, who represents the area, says he waited hours for care while in a wheelchair.
The concern is that the protocols are not being followed.
Further, investigators found 5 out of 8 employees reviewed had not completed required training before working on their own.
I do believe Cedar Hill opened far too quickly. I question whether or not, operationally, we're ready today for it.
And the mayor's office declined to comment directly, referring us to city health officials. The deputy mayor on public health just told us running a new hospital is complex, but they expect Cedar Hill to improve over time, noting progress, and the hospital remains under the same regulatory oversight as other hospitals with a commitment to safe care. And the hospital is part of George Washington University's health system. I reached out for comment, still waiting to hear back, as well as response to Councilman Zachary Parker's claim that you heard a woman's ovaries were mistakenly removed. Ben Dennis, DC News Now.
Some eye-opening accusations there, Ben. Thank you.